Hello everyone. Today we're going to demonstrate the safe care and transfer process for Ms. Johnson, a 75-year-old Caucasian female. She is diagnosed with chronic obstructive pulmonary disease and is being weaned off mechanical ventilation and is now on a rebreather mask with FiO2 at 30% in the intensive care unit. She is allergic to Cipro and weighs 350 pounds. The client had recently developed acute respiratory distress syndrome, which made her generally weak, requiring a two-man assist for mobility. The nurse will place the patient in the correct position for a physical assessment. After the physical assessment, the nurse will need to transfer the client to a chair to be transported to nuclear medicine for pulmonary blood flow tests. Ms. Johnson has a drip of 2 bronchial dilator meds infusing at 10 micrograms via IV pump and a normal saline at 200 milliliters an hour. Our objective in this video will be to explain and place the patient in a Fowler's position for the physical exam, how to transfer the patient from the bed to the chair, how will we transport the patient with the IV pump from the bed to the chair and through the hall to nuclear medicine for her test. Describe the process as the nurse provides oxygen from the bed to a portable O2 tank and how the nurse would provide care for this patient.
Hi, Ms. Johnson. My name is Sydney. I'm going to be one of your nurses today. And
This is Shamika. I'm going to put you in Fowler's position so she can do your physical assessment. But I'm just going to raise your bed up just a little bit.
The Fowler's position involves raising the head of the bed 45 to 60 degrees with her knees bent slightly to reduce pressure on the abdomen. Adjust the body with pillows for comfort to ensure her airways remain open. Once we place the patient in the correct position and ensure they are comfortable, Nurse Sydney can now perform her assessment of the patient.
okay, Ms. Johnson, we're going to get you ready for your nuclear medicine test, okay?
Next, we'll transfer Ms. Johnson from the bed to the chair. Due to her weakness and weight, this requires a two-person assist. We'll ensure the chair is positioned close to the bed and locked for safety. We'll use the gait belt to support her and avoid injury. 2 nurses will stand on either side of Mrs. Johnson, ensuring proper posture and holding the gait belt securely. On the count of 3, we'll lift and pause for a few moments. Be sure to ask the patient if they feel unsteady or wobbly. Once you have ensured the patient is stable, we will pivot and safely put Ms. Johnson in her chair. Here we have Nurse Rosa prepping Ms. Johnson's portable oxygen. First, ensure the IV drip is running correctly and secure the IV pump to the chair. It's critical to maintain the infusion rate at 10 micrograms. We will monitor it closely throughout the transfer. We will switch Ms. Johnson from the rebreather mask on her bed setup to a portable oxygen tank at the same FiO2 at 30%. The oxygen dial will be on 6 to keep the proper flow. Ensure the tubing is free from kinks and securely attached. With Ms. Johnson safely seated, we'll now transport her to nuclear medicine. We'll continuously monitor her oxygen and IV status as we move through the halls. As one nurse guides the chair, another one will walk alongside to ensure the IV lines and oxygen are working properly, checking for any signs of distress in Mrs. Johnson. In summary, safe patient care involves proper positioning, communication, and teamwork. From ensuring comfort during assessment to managing equipment during transport, every step is crucial to Mrs. Johnson's safety. Remember to always monitor vital signs and be prepared for any emergencies. Great job, team.